This is a manual muscle test for hip extension. Muscles being tested include the gluteus maximus, semitendinosus, semimembranosus, and long head of the biceps femoris. For testing grades 5 through 3 for all hip extensor muscles at the same time, the patient is positioned and prone with the knee extended. The clinician's force will be directed towards the floor. If the patient holds against maximal resistance, they'll score a grade 5. Against moderate to strong resistance, a grade 4, and a grade 3 if they complete the range and hold the position with no resistance.
Lift the leg up towards the ceiling. Hold. Don't let me push you down. Relax.
When performing a grade 2 test, the patient is positioned inside lying with the test leg up and the knee extended. The clinician supports the weight of the leg and stabilizes the pelvis. The patient scores a grade 2 if they're able to complete all available range of motion in the side lying position.
Kick the leg back towards me. Relax.
For testing grades 1 and 0, the patient is positioned and prone with the knee extended. The clinician palpates while the patient attempts to extend the hip or tighten the buttocks. If a muscle contraction can be palpated, the patient scores a grade 1. If no palpable contraction is present, the patient scores a grade 0.
Lift the leg towards the ceiling. Relax.
To try to isolate the gluteus maximus muscle, the patient is positioned and prone with the knee flexed to 90 degrees. This places the hamstrings in a position of active insufficiency. The clinician will be directing their force down towards the floor. As with the previous hip extension test, the patient scores a grade 5 if they can hold against maximal resistance, a grade 4 against strong to moderate resistance, and a grade 3 if they complete the range and hold the position with no resistance provided.
Alright, kick the foot up towards the ceiling. Hold. Don't let me push you down. Relax.
To complete a grade 2 level test, the patient is repositioned in the side lying with the knee flexed. The clinician supports the weight of the leg and stabilizes the pelvis. The patient earns a grade 2 if they can complete the available range of motion in the side lying position.
Kick the leg back towards me. And relax.
To assess grades 1 and 0 for the gluteus maximus, the patient is repositioned and prone with the knee flexed to 90 degrees. The clinician palpates the gluteus maximus muscle while the patient attempts to extend the hip or squeeze the buttocks. If a contraction is present, the grade is 1. If no contraction is palpable, the grade is 0.
Lift the leg up towards the ceiling. Relax.